Well, we know there's a harsh reality now. 50 million people in the United States are experiencing some type of mental illness, and that number only continues to grow.
Today is World Mental Health Day. To talk more about this epidemic and how you can seek help, we are joined by Dr. Sarah Paper with Allina Health. Dr. Paper, thanks so much for being here with us today.
Thank you for having me.
Yeah, you know, I think mental health has become a topic that we are discussing more and more post-COVID, but we know it really does affect so many people, ourselves, our family members, our friends.
Yes. Yeah, we're seeing the numbers climb for lots of different reasons. Some of it is the awareness and people's willingness. As we destigmatize mental illness, people are feeling more comfortable disclosing that they are experiencing those symptoms, and they're more aware themselves that they're having them. And then we have some conditions that have contributed, like the Surgeon General's report on loneliness, and that as an epidemic, I think is a huge contributing factor.
What are some of the impacts that mental health is having on our overall health?
It has a huge impact. You know, our mind, our body is all connected, and when our body doesn't feel good, our mind isn't going to feel good. When our mind doesn't feel good, our body doesn't feel good. And if you think too, if you're feeling depressed or anxious and so you can't get out and do the things that make you feel good, you're also going to miss out on those healthy opportunities that help you physically and mentally.
You talked about loneliness, and I think when we think of loneliness, we often think of older people. We know that mental health is a problem in our older population, but I've heard people use the phrase or use the terminology crisis for our teenagers and our young people when it comes to their mental health these days. Do you think it's at that point?
I don't want to get too catastrophic in how we think about it. I think it's really important, and especially for adolescents, they're in a state of distress. I don't know if I would use the word crisis, but distress, because teenagers are my favorite people, and I just think they're super resilient and amazing, and they also can be dramatic in the words that they use, and they are very lonely. I think all of us are, and we see it most often expressed in teens too. And if you are in any waiting room or a line for coffee, you can see that people are not engaged with each other, and we are social beings, and we need to be looking up and making eye contact and smiling. So we're missing all those little micro doses of connection. And with that, and if you sit even with teens and adults too, I think we can't just blame them, because I've seen adults do it as well. They are on their phones instead of looking at each other and talking to each other. They're talking and looking down, and we're missing all these opportunities to connect, and that has a toll as we do that day by day by day.
The social cues you talked about that we're missing out on. What do we need to do to get back on those? Is it as simple as just put your phone away and start a conversation with someone, or are there other things that we can do as a society to help?
I think that is a first step, absolutely, is to put our phones. Our phones can help us greatly. I'm not against phones at all. It's a wonderful tool for finding great places to meet up with people, you know, communicating and saying, hey, here I am. But we need to put them down when we're just in those casual moments, when we could be. It doesn't have to be having a conversation. Even just making eye contact and smiling at somebody makes a difference for us, makes a difference for them. We get that positive feedback when they smile back. You know, or even, I think of all the little kids walking around trying to make eye contact with the adults in a room, and sometimes they can't find one. And we know from research that was done a long time ago on the damage that has on young children when they're not having that reciprocated, when they're not being connected with. And it's painful to watch. And so if we all put that down and just look at each other and smile at each other, or we might notice that somebody's suffering. If we're not looking around a room, if we're not looking around the line in the coffee shop, we're not seeing that somebody's suffering. And just a smile or a compliment, or maybe you might be compelled to buy them a coffee or sit with them. It goes a long way. It goes a huge way. And that's just one step. There's lots of things we can do, but I think that's a great starting place.
Anybody who has looked for a mental health provider recently, or even within the past couple of years, for themselves, for their children, for their friends, they have run into obstacles. There are so many waiting lists out there. You know, not all insurance covers different kinds of therapy programs. I'm wondering, what is your advice if you are someone that is seeking out this support?
Yeah, it is. There is a shortage. There are long wait lists, which can be really discouraging. And so I think it's unfair if I came on here and said to everybody, you should go get a therapist, because it's not really that easy, and it's not an option for everybody, which is also affecting some of the increase in mental health numbers, is not everybody has access. But there are other resources. And so there are podcasts that people can listen to. There are support groups. You know, one thing that is affecting us emotionally and psychologically is that we have smaller families now, so we have less support in our lives, and we're less connected to community. So if you have a religious organization and there's groups there that you could be a part of, that can be helpful. Getting together with neighbors and arranging some sort of gathering that way is something I'm doing in my neighborhood and enjoying very much. Or, getting out and doing some exercise if you can. There are workbooks, there are apps, there are so many things that people can be doing to help themselves. And I would say if there's only one thing you could do too, is sleep. Sleep is the foundation of our health, our mental health and our physical health.
Right.
If you're not getting good sleep, I would talk to your doctor about that first.
Right. I remember one therapist told me once, I think 50% of what your problems are sleep.
Yep.
And the other 50% will be much easier to handle with more sleep.
Yes.
Which gets you to 100.
Yeah, you're in a better mood when you
Yes.
talk to those people once you have your phone down.
For sure. Yes.
If people were to leave this interview with one action step that they can take today, outside of sleep, what's the one action step that people can take moving forward?
Get together with other people.
Yeah.
The more we can be with other people, the better we feel. We are social creatures and we need to be with each other, whether it's during happy, cheerful moments or being there to support each other through painful moments. But it's hard to go to somebody when you need emotional support if you haven't had some of those regular everyday conversations with them.
The groundwork isn't there.
Yes, we need to be making connections.
Right. We talked about this yesterday during mid-morning about just this that study out of Harvard that looks at people over 75 years. They found the key to happiness is connecting with other people. And this goes back to this whole idea of loneliness.
Yes, which is amazing if you think about it. I like to see the positive in a lot of things.
Right.
Is that we all have in us then the capacity to help other people. If human connection is what makes people feel better, we can offer that to other people and we can seek it out for ourselves quite easily.
Doctor, thank you so much for this great conversation.
Thank you.